MedsPLUS Consulting Pharmacy and Wellness Center, you're not just a number. We offer individualized care for each of our patients, plus prescription delivery and medication management.
MedsPLUS is there for any and everyone who wants a special touch with their pharmacy needs.
Call or visit today for a free consultation.
Bringing the pharmacist back to the community, MedsPLUS Consulting Pharmacy and Wellness Center.
Visit MedsPLUS Consulting Pharmacy and Wellness Center in downtown Birmingham at the new South Federal Building.
Hey everybody, happy Monday. Happy Monday. Today is Monday, October 13th. I had to look. And it's 1 o'clock, which means it's time for MedsPLUS Medical Minute Live. I'm Dr. Pauline, joined by our amazing host, Dr. Jennifer. And we're going to come to you today and talk about something that is very important, especially because Dr. Jennifer and I are of the age that this particular condition affects. And because we know that many of our friends, colleagues, people that we engage with are too. And for the month of October, we've talked about several things: Cardiac Awareness Month, of course, Breast Cancer Awareness Month. But along the same lines of women's health, we want to talk about Menopause Awareness Month, the dreaded M word. So for those of you who don't know, menopause is actually defined as going 12 months without a menstrual period. And it starts usually between the ages of 45 to 55. And what it is it signals the natural part of going through the end of your reproductive years. So many of you know that you may start your menstrual cycles, in your teens, and throughout your life into your mid-40s, you are able to conceive children through the process your body goes through with the menstrual cycle. Well, menopause actually marks the end of those years, and it's when you've not had a menstrual cycle for at least 12 months. It's a natural part of aging, but it's also the beginning of a new chapter in your health journey.
That's right. During this transition, estrogen and progesterone levels decrease, which are hormones that help us regulate to be female. We also can have a decrease in testosterone as well. So Pauline mentioned about the age. So I want to say that I am currently in menopause. So and have been for quite some time. So what do you mean? So during my early 40s is when I first noticed changes happening, had a conversation with my physician, had my level checked, and yes, I was placed on hormone replacement therapy. That may not be the case for everyone, but mine was to the point to where the sweats, not night sweats, but hot flashes, sweats during the day. It could be hot, it could be cold. I would sweat, then I would get cold. It was a vicious cycle. And it got to the point to where I was embarrassed by it. And being in professional settings, people would say, "You're okay? Are you sick? Is everything all right?" And that's before fans were popular. So I would grab a piece of paper, fan myself, and then I have my jacket on. It was treacherous. But I will say, having talked to my doctor about it, and starting the hormone replacement therapy definitely helped a lot. Another thing about age is, depending upon when you were a girl and you started your menstrual cycle, that will kind of depict if you will start menopause in your early 40s, mid 40s, or even in your 50s. Some people don't start menopause until 55. So age does correlate with the onset based upon how early you started your menstrual cycle. So I've already talked about some of the physical and emotional changes, and that's typically how we know something is different, is our temperature regulator is broke or is off. So that causes us to experience the hot flashes, the night sweats, mood changes. So I like to think that the mood changes come about because of the flashes and the night sweats and you can't sleep. But there are also other changes internally that are happening that causes the mood changes. And one that I did not realize was the brain fog. This is more than just, okay, I came in here to get and can't find my keys, or why did I come in here? It's you can't keep yourself on track. You can have a list and the list keeps growing and you are unable to check anything off. Any and everything will distract you. So sometimes that can be a signal that we're going through the change, as we would call it, or perimenopause and then menopause. But menopause affects more than just your cycle, it impacts your whole body.
Exactly. So let's talk about what's happening in the body. So the first thing a lot of people notice is, oh my gosh, I'm doing the same thing. I'm eating the same foods. I'm moving my body the same, but I seem to be picking up weight.
Mhm.
Well, menopause can cause your metabolism to slow down. So even if you're doing the same activity, eating the same foods, you may start to gain weight because your metabolism is slowing down. And some people may notice that, they start breaking bones or hurting themselves easier. That's because your bone density can decrease. And all of this is due to a declining level of hormones like estrogen in your body. So osteoporosis risk goes up because of menopause. The other thing is your cholesterol levels may shift a little bit. So if you typically had normal cholesterols, your total cholesterol is less than 200, and now you seem to be creeping up a little bit. But again, you're eating the same foods, you're moving the same. Nothing really has changed. It could be because of menopause that your cholesterol is shifting, and that can actually increase your risk of heart disease. The next thing is your skin and hair become drier. And so that they may be a little bit more stiff. Your joints may feel stiff. That's kind of what I'm experiencing, where, you wake up and it's just like, oh my gosh, I have to do a full calisthenic stretching routine to get out of the bed in the morning. And then you may notice vaginal or urinary changes, maybe dryness, discomfort. All of these are caused by lower estrogen levels. And while they're common, you should not ignore these symptoms. Definitely talk to your healthcare provider.
And that is so important, particularly the last thing that you said, Pauline, when you talked about the vaginal or the urinary changes. And I think for so long, women may not have known what was going on with their bodies. So what happens? You start to get older, particularly if you're in a married relationship or any type of relationship. So if you're having trouble down there and you're not saying anything, but you're still continuing to have intercourse, it's going to be painful. Then you start to feel, okay, well, wait, am I too old? Is it a time I'm too old for sex? No, it is not. So that's why it's important, because there's treatments for that. For people that don't want to take medication by mouth, there's treatment through creams and other things that will be able to help at the site of where the issue is. So I think that that's one thing we need to really break down and to say, get it checked out. There are treatments available. And that's the good news. We don't have to suffer in silence. There are safe and effective ways that can manage symptoms and protect your health long term. Already mentioned hormone replacement therapy for some women, and for others, it's non-hormonal options. It could be other medication in the class of antidepressants. It could be supplements or just some lifestyle adjustments. And one thing to remember is this is individualized. What may be helpful or work for someone else may be different for you. So that's why it's important for you to seek care with a healthcare professional to be able to see what works for you. What works best depends on you.
Absolutely. And that's the main thing to remember. Here at Meds Plus, we really help women navigate menopause with personalized care. Many of you have heard in previous lives about our nutrigenomic testing. That's one tool that we have to take a look at. There's a specific component of that pertaining to women's care and women's health, where we look at how your body makes hormones, how your body uses hormones, and how your body metabolizes hormones. And if either one of those processes is off, you have a genetic weakness in one of those processes, it may not make you enter menopause earlier or later, but it can kind of determine the severity of your symptoms if your genetic response to hormones is different. So we work with the nutrigenomic test. We also review your medications. Many of you know that pharmacists are the medication experts. So because of that, we're able to look at the medications. Maybe there are some medications that you're on that may worsen symptoms. There are medications that can make hot flashes seem like they are worse, or that can decrease the level of fluid in your body, which can make things like vaginal dryness worse. So we can do a comprehensive review of your medications, see if there are any that are making your menopause symptoms worse, and then address that with your healthcare provider. And the last thing we do here at Meds Plus is we can recommend safe supplements to focus on the things that Dr. Jennifer mentioned: your mood, your bone health, sleep. All of those things, metabolism, all of those things are very important when you're treating menopause. And there are some supplements that have pretty good data that can help kind of control those things. So we're not just looking at dispensing medication to you. It's a holistic approach to help improve your symptoms.
So, ladies, this is your time to reclaim your wellness, or as I like to say, get your sexy back. The count is not out. We are still in this, and we want to show up as our full selves. So feel informed, empowered, and in control of your health. Once again, menopause is not an ending, it's a transformation.
That's right. And if you have any questions at all, if you have anything that you want us to discuss further, please give us a call here at the pharmacy, 205-650-4636. We'd be happy to walk through that with you and help support you through your transformation journey. Before we close out the live for today, we want to just kind of talk about some events that we have coming up. Y'all know that we are always in the community. We're always making sure that people are aware of the services that we offer, and also going out to serve people. The last couple of weeks, Jennifer has pretty much been out of the office doing community-based vaccine clinics. And that's just an amazing service we offer, where, especially for our seniors who may have barriers like transportation, being able to get into their doctor's office, we actually go to them and provide vaccines. But we do want to talk through some events that we have coming up this weekend. And I'm pulling up the calendar because, of course, I can't remember any of this off the top of my head.
Well, while you're doing that, I'll
ahead.
mention the ones for Saturday. You can mention
Okay.
Sunday. So Saturday, we will be joining the Birmingham Black Nurses Association. They will be having the violence reduction program at the Birmingham Civil Rights Institute. So we'll be there providing vaccines. And that event will be from 9 a.m., 10 a.m. to 1 p.m.
Okay, 10 a.m. to 1 p.m. at the Birmingham Civil Rights Institute.
Yes, and we'll also be at Zion Star Baptist Church. They're having a community health fair. And we'll also be providing blood pressure and vaccinations there as well.
Yep, and that one is 10 a.m. to 1 p.m. Yes, and then on Sunday, we have two events that are scheduled. The first is we'll be doing a vaccine clinic at Rising Star Baptist Church. That's Rising Star Baptist Church on 2nd Avenue West in Birmingham. We'll be providing all ACIP recommended vaccines from 12 p.m. to 2 p.m. So if you're in the area of Rising Star Baptist Church, definitely come by and see us. Make sure you're up to date on your vaccines. And I just want to explain a little bit about that. When we say make sure you're up to date, we talk about this in the form of our children. So many of you know that we will take our children to their pediatrician, and based on their age, there are certain vaccines that are recommended based on their age. Once we become an adult, that does not change. We still recommend that you get your annual flu shot. If you are at risk for severe disease, we recommend that you get the annual, the COVID shot. But then there are other vaccines that you can get, such as if you're over the age of 50, we recommend the shingles vaccine. If you're over the age of 60, we recommend the RSV vaccine, especially if you have risk for respiratory illness. So we do a vaccine checkup before we administer the vaccines, just to make sure we compare what you need with what you have based on the state vaccine registry. So I just want to put that little bit out there.
Thank you. I'm sorry. Thank you so much for bringing that up, because that, Pauline, at each clinic, when I'm talking to someone middle-aged and I ask the question, are you up to date? Yeah, I got the boosters. I got this, I got that. How many more do I need? Well, that's when we have to educate, and a lot of people are not aware. So thank you for taking the time to explain that no, they're not boosters. They're yearly, based upon your condition. And yes, we do the vaccine checkup. So
absolutely. Great. And then the other thing we wanted to let you know of is this event will be participating in on Sunday, called the Voices of Victory 2025. It's going to be at Lynn Park on Sunday, October 19th from 2 p.m. until 5 p.m. You can see all the food trucks and small business support, community resources. So if you're in or around downtown Birmingham on Sunday evening, come check us out in Lynn Park.
Absolutely. So a lot of things out there, a lot of good resources, and we want you to be able to take a part. But don't remember, menopause, we are here to help in a personalized, individualized way through our nutrigenomic testing, as well as medication review. Ladies, let's take charge. Let's start early. Let's go ahead in the silence, start this conversation, and let's wait for our transformation.
Bye, everybody. See y'all next week. Bye.
At MedsPLUS Consulting Pharmacy and Wellness Center, results matter. Don't settle for less when it comes to your health. Empower your health journey with a pharmacy that puts you first. Transferring your pharmacy is easy with our guidance. Plus, we offer prescription delivery and medication management.
Bringing the pharmacist back to the community. MedsPLUS Consulting Pharmacy and Wellness Center.
Visit MedsPLUS Consulting Pharmacy and Wellness Center in downtown Birmingham at the new South Federal Building.